And over the years, we have been able to participate in capacity building processes, which have been very impactful in our work, especially towards the budget making process and advocating for increased financing towards sexual reproductive health and rights, and even family planning commodities in the county of Kisumu. And so we have been able to learn a lot about budget making process, and in this process we've also been able to disseminate this information to our organizations and also to the community, so that they can have an interest in understanding the governance issues that affect them, and being able to participate in actually public participation and understand what is being discussed there, and also to make meaningful contributions in these public participation forums, so that the needs of the community can be able to be identified and to be reflected in the county annual development plans and also in the county budget.
Meta CSOs Alliance have really helped different grassroots CSOs to understand the budget processes through a number of training, where they'll be able to train them about county budget making processes, where the CSO right now can be able to participate and they know the dates of different public participation forums, beginning from when the circular is sent to different departments to when the bill is signed, and they get involved and participate to ensure that their views are really taken into consideration. During the TWG, that is the technical working group that Meta Alliance have been supporting, it has been enabled a number of CSOs and grassroots CSOs to sit in tables with the executive and also the county health department, even the minister, the director, where they share ideas and also come with interventions to ensure that they have improved health within Kisumu County.
Meta, under her program, a sustainable finance, they've been able to capacity build CSOs on budget advocacy, and the NIA team was part of it. So we are in a position to analyze county budgets, looking into other budget documents, and coming from my organization with our background of budget analysis. So then in addition, this has also impacted so much, where we've been sharing ideas with other CSOs members, and we are closely working with the members of County Assembly who are drawn from the Health and Budget Committee. So this is a team that has been helping us in getting the key documents, and not forgetting a very close members who are the clerks who then sit in the Budget and Health Committee. These are teams that are helpful in terms of getting the budget documents. So this program has also enabled us to reach out to the community. As we speak, they're in a position to get these documents. They are in a position to analyze these documents. However, there could be a few gaps here and there, but so far they're in a position to analyze these documents because we've taken them through all these processes as well. They are in a position to know by this particular time these documents should be ready, and where can they get them from.
So it's amazing to be part of Meta Kenya Alliance. We've done so much together as a team in Meta Kenya Alliance. We've been working together at the community level, reaching people. We've been able to take part in the budget process at the community level, learn from each other. Apart from that, I think we have been very successful in advocacy. We've seen increase in budget. I know we cannot associate it to only our work, but we think we have been part of that contribution because we've been able to engage the county assembly members, and we've also been able to engage the CHMT as members of Alliance at different points, and that I think is very, very powerful. We've also gone to the community. We have community units. We are divided into groups at the community, and working in those community groups gives us ability to reach the people in the community. So we don't work without our constituency. Our constituency gets feedback from us, and we also get feedback from them. Financing is the greatest point of exclusion for most people because health is expensive. So if in a country like ours that is developing, people do not have a source of or a way to pay for their health care, most of us end up living with conditions that could be prevented. That is one. Another thing is that speaking from the angle of SRHR, a lot of issues of SRHR have been neglected, not because people don't think they're important, but because they can't afford them. And in our context, people still think that, for instance, family planning is a luxury when you have to pay for it, but they realize it is a necessity when now they have families that they cannot sustain. So I think it is critical to look at financing for reproductive health services, because it not only saves money for the families, it also saves money for the government.